Hello, friends. In this episode, we're exploring a topic that might seem a bit outside of our usual scope, but it's incredibly important, and that's mental health. Many of you have requested an episode on mental health, and it might be our most requested topic. Not surprising, given the unique challenges we face in our sport. As someone who's personally benefited from therapy, I want to attest to the profound impact that it's had on my mental well being, performance with my sports, performance at work, and my overall balance and happiness. We are some of the luckiest people. We experience a unique angle on the intense beauty and power of nature, profound bonds with our friends, and just a ridiculous amounts of fun. But on the flip side, we also face the harsh reality of loss and grief, witnessing friends die and receiving sometimes devastating news in ways that those outside of our world might struggle to even understand. It's not about seeking sympathy, it's about acknowledging our experiences and finding ways to live our very best lives despite the intense contrast we face. Therapy has been a valuable tool for me in navigating these challenges, and I want to share some practical benefits it can offer. And I know, based on the messages I've received, a lot of you are quietly struggling and sometimes alone. I hope this episode will provide some clarity and encouragement for some of you who might be on the fence or have some preconceived notions about what therapy is or can offer. So I'm happy to introduce our guest, Sara Pendlebury of Chamonix Therapy. Sara is a registered psychotherapist who's worked extensively with mountain adventure athletes like us. After 20 plus years of experience in the corporate world, she cut it all away to live in Chamonix, driven by her love for the mountains and skiing, something I can definitely relate to. And this also gives her some insight to work with misfits like us. Sara practices the human givens approach. It's a system based on the idea that humans have innate needs and resources. When these needs, such as security, attention, emotional connection, and meaning, are all met in a balanced way, individuals are more likely to experience positive mental health and well-being. Again, her insights and experience have been highly valuable for me, and I hope her perspective can help all of us in our journey to squeeze this life for every bit of adventure and happiness possible. So with that, let's dive into my conversation with Sara Pendlebury.
You down there?
Yeah, my brother.
Have fun.
Come on.
Looking good.
All right, 3, 2, 1. See ya.
What? Yeah.
Hello, friends. You're listening to Exit Point.
A podcast about the advancement of base jumping and the exploration of its culture.
Join us for valuable insights and gripping stories from some of the world's top adventure athletes.
Oh my God, I took that.
Thank you so much for inviting me over to your place to do this. Thanks for your time. And, this has been an extremely daunting proposition. I've had lots of people requesting that we talk about mental health, and it's definitely been a topic that I wanted to address. And I think difficult for a number of reasons. One, I'm not an expert in the field, and I'm going to show my ignorance perhaps, or my lack of knowledge. And so that was a little bit, challenging and scary. And then also I think that in order for this to be effective, I have to put a little bit of myself into it and my own personal experience. And for full disclosure, we've worked together. And that's a question I have for you actually is, am I a patient or a client, or how?
Yeah, we talked about that, didn't we? I think there's a difference between different cultures, and it's very much where I suppose it's very much where mental health is in each culture. In France, I've recently done a study. I've been studying, I should say, to become an art therapist, and quite a lot of the people there on the course, the delegates, were very angry at the idea of a patient being a client, because you're caring for somebody, you're not expecting money from them. It's kind of the idea. But the client idea is important because it implies that two people are walking side by side. And you mentioned not being an expert in the subject. Well, no one is really. No one is an expert in humanity, what it is to be human. We're all human. Yeah, we all suffer from the human condition. And very much the difference between a therapist and somebody who is their client or patient. It's just that the therapist has maybe spent a little bit longer looking at it, but they're not an expert. They're working together and trying to work with the individual and what their specific circumstances are. So to reassure you there, it's I don't think there's that many experts out there.
Well, as close to expertise as we can get, I thought that you were very well suited to talk to me and talk to our audience because of your experience and where you're located and the clients that you've worked with.
Yes.
Or patients.
Yes.
And could I ask you to introduce yourself and talk a little bit about where we are and your experience, of course?
Yeah, absolutely. Well, we're sitting right now in my front room in Argentière. We're just at the foot of the Grand Monté. I moved here about 20 years ago now. I was working in the corporate world, not unlike you, but various things happened in my life and my husband's as well, and we decided to make a change. We're skiers, and we came to the mountains for the ski, the love of the mountains and the skiing. I also at the same time began training as a therapist, and I work in like various modalities, but fundamentally I'm what's known as a human givens therapist, which means that I look at people's needs and what needs aren't being met and what resources they have and what obstacles they have that get in the way of them meeting their needs. I have also deepened that, and I've looked specifically at developmental trauma, and I'm also an art therapist.
Great. Can we, before we get too far into this conversation, I think it's important to talk about what mental health is. And I think it's important because a lot of us are very goal-driven, and we're also have been exposed to maybe popular culture or these terms being thrown around, and it's perhaps difficult to understand exactly what we're working towards or what we're trying to maintain. And so in the context of someone who, participates in mountain sports, extreme sports, mountain adventure sports, what would you say mental health is?
Yeah, in that context, I think it's a really interesting context because from what I've observed, a lot of people come to a place like Chamonix, and it is therapy in itself when they reach such a beautiful place, or they reach the mountains. They're struck by the beauty, the awe of the mountains, and for a lot of people, it has really had that effect on them, and it's changed their lives. I've spoken to many people in my practice here who would say, this went on in my family, in my life, whatever. And then I came here. And then there's a hiatus for about 10 years or something, or 15 years. And then suddenly they think, well, maybe I could look at that again. But you ask a really good question. What is mental health? We can argue that somebody is mentally healthy simply by saying, are they meeting their emotional needs? And are they using their own resources, the resources that they have either innate to them or maybe they're skills that they've learnt in life, but they're seen as resources. Are they using those resources to meet the needs? And by meeting the needs, we also sort of develop the muscle of accessing our resources. Before we started to record, we were talking about injury, for example, and the effect that can have. Injury in a sport, especially if you follow it passionately and you're doing it weekly, daily, it can actually stop you meeting your need for movement and getting out there and being in community. That's an example of how a blockage in a resource or a blockage in something or in the environment can stop us meeting our needs. And it can happen quite quickly. Someone can have an injury and then get into quite a difficult locked state of depression without really realizing it's happening, and it's because they're just not being able to meet that particular need. And we see that there are roughly nine emotional needs that we have. We have a need for security. We have a need for attention. So security would be a safe environment where we can really feel that we can develop fully in whatever we're doing. Attention, again, is about giving and receiving attention. Control. Obviously, the need for control is very important, and it goes together with our need for security. But in all of these, we're not talking about needs that are out of balance. We're talking about meeting our needs in balance. So if you find that you're in a situation where you're more a control freak, that's not what we're talking about. It's about the need being met in balance, need for community. And I know that you come from a very great community of people who all share the same passion for your sport. Intimacy, which is really this idea that someone gets you, someone understands you. We have a sense of status, and our sense of status should be, it's not really, it's not about having the best car or the best house or the best job, but it's very much where I fit in with that social group, going back to the community. We have a need for achievement, and again, we were talking about performance, and we're talking about sport, and that really comes into all the things that you do. We also have a need for privacy, which is lots of, broadly speaking, this ability to really reflect on what's going on and consolidate our experience. And I often meet people, especially in this kind of community, where that is an issue. They feel overwhelmed and overload. And we also have a real need in life for meaning and purpose. And the idea being that a little bit like the injury, if it gets in the way of our need for movement, if any of these needs are blocked, just one of them can actually send us into a place where we don't feel so good. But this is not necessarily something that is static. And just because you didn't meet your need last week doesn't mean to say you can't meet it next week. It seems simplistic, but actually all these needs are interwoven, and they all impact each other. And they can all be impacted by our own history, our attachment, any losses we've had, any trauma, our personality type. Anything can impact our ability to meet these needs. And then, as I said, we also have resources that we need to be able to access in order to meet these needs. And this is really seen as quite an evolutionary gift that humans have, that accessing our resources enables us to meet our needs.
Now, these resources and meeting these needs, does that work in the opposite direction? Because you said if these aren't met, that we don't feel good. Does that mean that the more that we nurture these needs, that the better we feel?
Absolutely.
Okay.
Absolutely. So going back to what is good mental health, it would be someone who, I would say, is someone who is meeting their needs consistently. And when they're not meeting their needs, they know it. And they do something about it, or they're able to do something about it, or they're able to go and get help to do something about it and get support.
Now, as someone who's been living and working in Chamonix for such a long time, do you feel or have a sense that people who are engaged in high-risk mountain sports have certain needs that are outside of the norm? Or are some of these maybe exaggerated, or is there any difference? Are we different?
We're definitely different. I think that's a really good question. There's often a bit of searching. When I first meet somebody, I will actually ask them their history and how they came to Chamonix, how they came to not just Chamonix, how they came to the mountain environment, I suppose. My previous experience, I worked in the corporate world, and I worked with people who were very driven. And in so-called leaving that world and, taking a different approach to life from the mountains, which from the outside, from the London perspective, for example, looked like dropping out. No. People are so driven, and the need for achievement is something that I really, really see in a lot of people. And this is not to criticize it. It's just to ask the question, is it met in balance? We need this need for achievement, but is it met in balance? Control. I think the performance sports give a lot of us that sense of mastery, and which is, again, connected to control. And that would come up. What goes on a lot, I see, are issues around community, and issues around attention. And perhaps the fundamental reason why people came in the first place was, really looking for that need for security. And that is when you would begin to look into, is there an element of a pre-existing trauma perhaps, or some issue, or some, and sometimes it's not trauma per se, sometimes it's just conditioning or a way of thinking, but they were brought here for a need for security.
That's interesting. It's kind of the opposite of maybe most of us would think. Someone dies in the mountains here almost every day. So saying that someone is looking for security by coming here and participating in these mountain sports is a bit contradictory in a way.
Yeah.
Could you elaborate a little bit?
Yeah, I mean, we're all looking for safety. We are. So, look, I've listened to a few of your excellent podcasts, and I've learned from it as well.
No, thank you.
I've learned how you think, and it's not my community. And I don't think there's any of the mountain sports that we do that don't put safety right up there, either in the way they're regulated, and sometimes that can be bogus. For example, skiing you're far less likely to be injured skiing than you are playing football on Saturday. But there you go, and that's from A&E statistics. But I think all of the mountain sports, we have to think about security, even if it's not something that's front of mind. So all your training that you do and all the thinking that you do before a jump, you've got security in mind. Or were you referring more to the kind of move? I'm going to go and set up my life. I'm going to do a season. I'm going to live in this place. And we find security perhaps in the activities we do, but it doesn't necessarily exist for people in the environment that they find themselves in socially. Perhaps that'd be the way of looking at it.
Now, one of the challenges is I think that many people who engage in high-risk sports, particularly base jumping, is and their challenge in finding a therapist or someone to work with is feeling understood. And because oftentimes in our regular life, we'll meet people and it's always a couple of things. It's, oh, wow, you're so crazy. Oh, I would never do that. Or it's met with this sort of awe of like, wow, Is that what you do? Wow, tell me more.
Yeah.
Absolutely dominates the conversation.
Yeah.
And I think a lot of us who may have approached therapy or are considering it or have written it off just think that this is going to be another one of those conversations where we have to explain ourselves and
Another
maybe
block.
Yeah. Has that been the challenge for you as a therapist? Is that something that is a block?
That's a really good question. And I don't mind saying that before I met people from your community, I didn't understand it myself. But now I can make the comparison that people make about skiing. I hear people say, like I said before, they think it's a really dangerous sport. But relative to what people do every day, it isn't necessarily. And if you approach anything in the right way, you can be safe. As a therapist, and what good therapy is really, and this is something we can explore, you have to get into the other person's model of reality, as we call it, or you have to walk in their shoes, is another way of putting it. You can't be judgmental. You can't say that's crazy what you're doing, but you can ask. You can challenge. What is your motivation for this? And I'm happy to be asked about it, about my own skiing, for example. So no, it shouldn't be a block. We do have to understand, but it is part of the full picture. And so I didn't understand it as a sport, and then I began to meet people from your community as clients. And this was a good learning curve for me as well. I was able to, by walking in their shoes and understanding, to sort of roll it back and to realize that, yes, I had some preconceived ideas. And where I really found my biggest interest in, we were talking about the resources that we need to access to meet our needs. And it was really this idea of self-regulation that I saw in every single person I spoke to. Although they may have all sorts of different things happening in their lives, and we're all different, and circumstances change everything, this ability to self-regulate through the sport and because of the sport was actually a real gift that they brought into the rest of their lives, and sort of working with that in various different ways with different people, I was able to use that as their resource. So it's not about looking at someone and talking about their life choices. It's about seeing what's working for them in their life and what's not working for them in their life, and using what is working or what has worked in the past to perhaps get over an obstacle or turn a corner.
When you say self-regulate, maybe you can expand on that a little bit more. What do you mean by that?
This goes back to your question about what is good mental health. I said, if people are meeting their needs in balance, they will probably feel okay. When we begin to feel out of balance, another way of putting that is we're not regulated, we're dysregulated. And when I'm talking here about maybe racing thoughts or feelings of overwhelm, or it is probably and most likely will be accompanied by physical sensations of anxiety, depression, nervousness, that kind of, that knot in your stomach or that feeling in your throat. And a lot of regulation can be achieved, and a lot of the work we do is around breathing and using our natural way of regulating ourselves, which all babies know how to do, for example, just relearning that with a form of breathing which is relaxing and self-regulating. What I discovered in meeting the various different people from the wingsuit community was that they did this automatically. It was something they needed to do for the sport, and if it wasn't in place, they would explain to me they'd turn back. As much as it pained them, they knew that was the important thing to do. Now, I don't see that in many different sports, but you see it a lot in solo climbers, free climbers, for example. It's exactly the same thinking. And I think the more that we can deploy that and use that and just say, well, look, today just isn't the day. And I don't know if you can hear in that expression, it's very much, there's a real letting yourself off the hook of needing, there's the dog.
Let me grab him.
So there's a real sense of letting yourself off the hook in that expression of today is not the day. Self-pressure goes away. Needing to meet other people's expectations of you goes away. And I think that self-regulation is something that we actually do aspire to for everybody, and it can be redeployed into other areas of life.
Wow, that's really interesting that you picked up on that, because that's something that I've hoped to showcase a lot in the podcast is the power of walking down.
Yeah.
And it's, for one, it can mean someone's survival.
Yeah.
And
absolutely.
And I think it can be quite complex.
Yeah.
And I have to be honest here and say that it's not always been super easy for me. There has been a lot of times where I've walked down and had these repetitive thoughts, had these racing feelings, had these like knots in my stomach continually walking down the hill going, why am I feeling this way today? Or putting a sense of judgment on it.
Yeah.
And as I've had, years in the sport and become more mature around that topic, I now greet it openly. And my knees hurt sometimes when I'm walking down the hill. Nobody wants to do it, and a lot of that is also decision making before I even get to the exit point now, because I've familiarized myself, realizing, maybe I'm not going to feel good then, this and that. But this sense of walking down, it's really interesting that you picked up on that. And I'm interested to hear how perhaps if someone doesn't feel like they have the awareness or they haven't been able to effectively pick up on that, maybe they found themselves at the exit point with a lot of anxiety. They haven't been able to calm themselves down. What are some methods that people can employ to perhaps develop that sense of personal awareness or self-regulation?
Yeah. Okay. And that would be a really interesting session to have with somebody. Again, context is everything. So, what is going on that has led to this situation. There could be thousands of factors. It could be something that happened the day before to that person and nothing to do with the sport, for example. But it could be the weather. It could be just a gut feel. And that gut feel that we have is like that we have a sense in our belly that something is not right. And often, I mean, the similarity with this and avalanches and avalanche awareness is 100% there. Quite often people have a sense that things aren't right. In avalanches, we can look for signs, can't we? We can look for, perhaps there's been recent avalanche activity, or there's we've read the avalanche bulletin that day, and it says it's really not a good idea. And then we get another sign, and we say we want to go back, and it's a really difficult feeling. The other thing to tap into would be, you described really well that sense of you walking down the hill and your knees are hurting and you'd rather have jumped, and there's a sort of I detect a little bit of self-judgment coming in there about, why am I feeling like this?
Yeah, for sure.
How dare I go up there in the first place and come down again? Or I mean, can you expand a bit on that for your listeners?
Yeah, I mean, I think now that you're asking me about it, the first thing that flashed into my mind is like, one of the things that I've found so powerful about base jumping is the sense of accomplishment, or sense that I am almost superhuman.
Yeah.
That I can do this, that I can, hike really fast up a mountain, jump off of a cliff and fly away. I mean, this is absolutely amazing in a lot of people's eyes, in my own eyes.
It's truly amazing.
It's
I'm sorry, it really is.
And, I think when you walk down, it's almost the opposite. It's that you don't have this sense of capability. That's what the word I was looking for. You feel really capable.
Yeah, mastery, the control, the achievement that we were talking about earlier. They get compromised for you in that moment. And that's understandable, because that's not what you set out to do. But what you have done is you've shown that you are so human. And it's that humanity. And you have walked down the hill with all of your humanity, which is to say, I'm better off doing this than risking the alternative, which I'm not sure about. And the normal time when you do jump, and it is, from what I've heard and from what I experience, it's never something I've done, is that you have a sense that it's going to be okay. And that sense comes from experience, and your sense of control is not being second guessed by this doubt in your belly. So I would if that was someone in front of me saying that this has happened to me a couple of times or something like this, what's going on? Is it me? I think there'd be quite a lot to explore there in the truth of what was being told by their own senses, and that they have mastery there as well. That the fact that they were picking up on something is okay, and they can listen to their intuition as well. Again, as long as it's in balance.
Well, I think you've hit on a lot of really important topics that are different for everyone. Again, I think that, like, from my own experience, walking down is really less difficult because of the vicinity of the cliffs. I've moved across the world to be close to these mountains, and just deciding not to go is pretty easy.
Yeah.
And
you've got no sunk cost in it, really.
Really.
So whereas if you compare yourself to the avalanche victims who travelled across the country and that was their last day of the holiday and they were going to do it, whatever, sunk cost is high.
Yeah, absolutely. And that goes for our sport as well. As oftentimes people come from out of country and they've traveled to spend thousands on their travel expenses. They only have a certain amount of days.
Yeah.
And
I imagine it's quite expensive.
It can be.
Yeah.
Yeah.
So there's a real sense of, this is my opportunity and I've got this time off. And
exactly.
Yeah.
I don't know how to get around that or to help people get around that. I think part of it is what I've tried to do is to show people who've been in the sport for a long time and talk to them and have them share their experience and basically share how wonderful it can be to have a long game.
Yeah.
And the sense of urgency that you may have right now is going to disappear one way or the other.
And a sense of urgency is also something that we can work on, and that does come up for all sorts of people. And a sense of urgency is often in that desire as a kid to sort out, to fix whatever it is that's going on. It has to be done now. And the long game is really interesting that you say that that's where you feel you've got to now. From having been very disconcerted by walking down to actually moving into a situation where you say, well, actually, that's okay for today. But a lot of it, as you say, it's environmental. It's because you just live near the cliffs. So the sunk costs have been dealt with.
I think it's important to talk about peer pressure as well.
Yeah.
That,
Let's talk
it
about
feels
that.
really good to be part of a crew.
That's the community need. That's
gangs
the
going up the hill.
Status. I'm part of this gang. They understand me. They get me. Unlike those other people who didn't, I'm with these people. Yeah. And then suddenly you can't do it. Or you don't want to do it, or it doesn't feel right. And I think that goes across all mountain sports, doesn't it?
Absolutely.
But obviously the stakes are different. What we're talking about here. How does it show up? What do you observe? What do you see?
Well, in terms of peer pressure?
Yeah. How is it? And sort of outline the scenarios.
Well, I think it's been a long time since I've had a sense of peer pressure, just because I would say now I'm pretty comfortable in who I am in my own practice with the sport. And I really don't give a shit about what people think about it anymore, to a certain level.
Yeah, but that's been earned, hasn't it? I mean, over time and experience and...
So there was this one jump that I went on with there was, I think, I would say around 5 of us, 5 or 6. And it's over on the other side of the valley. It's at the Point Dacher. And there's different areas where you can jump from. There's one that's up at the very top, which is the most challenging and most technical, meaning that when you jump off of the cliff, you really need to get your wingsuit flying quickly or you could impact. So the cliff is shorter. And then there's another one that is much more forgiving. And so we went to the Point Dacher, and it was me and another guy he's been in the sport, I think, for over 20 years. And we're both parents. And then it was the other crew of younger guys. And, it wasn't that I was worried about what they thought about me, but when we made that decision that me and the other Papa Jumper were going to go to the easier one, I can't lie. There was a feeling inside of me where it was like, ooh, I'm not one of the big boys anymore.
I've gone to that group. Yeah.
I can't say it was easy.
Right. What kind of feelings came up for you?
Well, I had this sense of like this really exciting chapter of my life was behind me now, which is absolutely ridiculous because here I am ready to jump off of a cliff and fly away in my wingsuit.
Yes, exactly. But you still had that feeling and you acknowledge it and you have the awareness to see that, I was feeling that. Yeah. Yeah.
And so you asked me for my perspective on that. And I also saw, which was really interesting because this is all sort of chance, I think, is that one of the other people who was visiting went to the top of that cliff with them. And he's also a parent and has also been in the sport for a long time. And he had a gear malfunction before he jumped. And he was forced to walk down. Completely. And to be honest, I was quite worried about him. I kept my mouth shut because it was, his decision. And I saw the peer pressure maybe get the best of him. And when he walked down, I was, almost a sense of relief of like, oh,
for him.
Yeah. And I can't say that I was stronger in that moment, or I can't say that he may have looked over the edge or measured it with his laser and chosen to do something different. Maybe that malfunction didn't actually happen and that was a way that he could save face and walk down. I don't know. But that was the last time that I experienced that sense of peer pressure.
Okay. Okay, that's interesting. But I think it's really helpful to share to everybody, isn't it, that it exists, and that's how it felt, and also the feeling of relief you felt for the other person, because you could sense that there was this part of you at least that was curious: have they just gone along with the peer pressure, and did they thankfully find a reason to get out? And that in and of itself is interesting, isn't it? The idea that there could even be an excuse, rather than just saying, no, it's not for me today. There's something in that, isn't there? There's something in the community, there's something in the way that the society that does this works, that makes it, is it okay to say, I'm going to get out of this, or I've got an equipment malfunction? There's
Right.
something in that to explore for the whole community, perhaps, to make it okay. A sort of Me Too moment of, I had equipment failure too.
But I think it goes back to what we were talking about earlier in that sense of capability, right? Because if you have to walk down, or you decide to go to an easier exit, it challenges your sense of capability. And and we're talking about peer pressure here, and they didn't say anything to the contrary. That peer pressure came completely from me.
It's self-pressuring. And it's very much that we're talking about, which is something that can come up again and again in a person, that they're putting pressure on themselves. It's not the rest of the world that's doing it to them. They can say, "Oh, I feel the peer pressure," but it's actually the pressure they're putting on themselves. So why are we trying so hard? Why are we making such an effort? Why? What is that about? What are we protecting? What is happening with that? That can be something that can be explored in a safe place, which is what therapy should be, in a way that allows you to see it for what it is, and celebrate pressure when it's around achievement that is really meaningful and worthwhile for you, and let it go when it's not necessary, and to see the difference between the two.
This might be a good segue for us to talk about exactly what therapy is. I can't generalize, or we can't generalize about therapy as a whole, but I originally came to you when I was having a sense of being overwhelmed. And I think a lot of people talk about it in the same way, and that cup that I have has different water being poured into it, or different emotional loads being poured into that cup. And it had we had just been off of COVID, and working as a journalist, it was extremely difficult. Our hours were long. The subject matter was challenging. And then shortly thereafter, the war in Ukraine. And I'm going to get real personal here, but witnessing and seeing all the raw imagery of war is particularly challenging. And what I learned from early on from one of our sessions was that, I have to also add that there was, other parts of my life, being a new parent added a lot to that cup. Some of my past experiences as a paramedic were in that cup. Witnessing fatality accidents in base jumping were in that cup. And so at that particular moment in my life, the cup overflowed.
Absolutely. And talking about it now, looking back, it's not a surprise, is it?
No. That's a lot for anybody to carry.
Yeah, it really is.
And, one of the surprises that I had going into it was the sense that I had this idea that, I'm just good at that. I'm good at carrying this big cup.
Yeah.
Right? Back to maybe the sense of capability again. But I think maybe where we can take this now is and I share this with hopes of maybe someone listening to this will realize that therapy might not be exactly what they expected, or this preconceived notion of what it is. And that, going into the therapy, it wasn't something where you asked me to just talk about my feelings. It was very directed, and the thing that I really appreciated about the whole experience was that you gave me specific tools that were going to address very tangible things. And maybe before I continue any further, perhaps you can share with us what therapy is and what a session is like.
Sure. If I think about, you're right. If I think back to if I can use that as an example,
Please.
But I would also like to say that the story that you've just outlined and the circumstances that you've just outlined, and particularly with the visual images, I think, of the war that were coming in, it was almost like the last straw of seeing daily carnage and suffering. And working in a journalistic environment, which I've also done in the past, there is a big expectation to just deal with it because it's a daily occurrence. The story that you outline and the circumstances you outline aren't that unusual. Most people come to me if they do get as far as therapy in a great state of overwhelm. And the first thing to do is to build trust and rapport with the person, and to let them trust that it will be okay to just sit there with all the stuff that's going on. And, that can take maybe a session or so, just to really trust that this will make a difference. Wouldn't you say? There's a sort of sense of, whoa, is this really going to work with all this going on? How can it all be made sense of just by talking it through? A meeting online as well, not even in person. So the building of trust is really important, and the understanding of the other person, and again, this non-judgmental. And there's no question about anything being judgmental. The person's come because their system, the self-regulation part of the system, I'm talking about the physical system and an emotional system, has become overloaded. And then I think it is worth looking to see, what are the causes of this and which needs aren't being met and what resources does the person have, which is pretty much what we did. We got to know each other. I understood your resources. I understood what you do. And we looked into conditioning and, maybe not in your case, but in other cases, we would look into just thoughts, conditioning, where people come from, background, and in some cases, not yours, but other cases, there may have been a massive history of abuse or the worst imaginable things going on, and just seeing how that has left a wound, that this new thing that's happening, for example, a war in Ukraine or Gaza, impacts the pain that was there already, and understanding that and holding it with the compassion that it's okay to feel this way, and it will pass. That's the other thing. It will pass. It's just something has come up because it's been too much at that moment. In terms of specific tools, what did we do? I just can't remember. I think a lot of our stuff that we talked about, and we're talking a couple of years ago now, aren't we? Was about allowing the space without the judgment, and also a lot of normalizing. To be fair, it was a lot about, look, this is reasonable that you'd feel this way. You're not losing it. You're not losing it. Anybody in your situation would feel this way. And it goes back to that self-pressuring and what goes on in the self and what goes on in the heart and what goes on in the body when this feeling of I must achieve and I must have, the word you were using is capability. I must have this capability. Well, no, I don't have to have it every day. And people will still love me, even if I don't show up with it every day.
Yeah, that's I'm at a bit of a loss all of a sudden.
Well, it's not surprising because you can cut this bit. We've kind of gone into the personal, and it's okay.
Well, just backing up a little bit, I think one of the resources that I had used for so many years was jumping.
Yeah.
Because here's this moment where, I'm getting exercise, I'm in the mountains, I'm generally with friends, and it's a couple of hours of really just checking out of normal day life.
Yeah.
And, oh man, when you jump, that sense of like letting everything, all the problems just float away is incredible.
Yeah.
And it's maybe one of the most powerful distraction tools I've ever experienced. And when I say distraction is because I didn't really feel like any of those things were being worked on or helped. The issues that I had was working with on a daily basis, it gave me that sense of relief. Like I didn't have to think about it.
Yeah.
And then also then at that point, being a new parent and having a lot less time on my hands meant less jumping. And so
You couldn't use that resource.
I couldn't use that resource.
So this goes back to what we were saying originally about a lot of people will find that the mountains are a therapeutic, and whatever their activity is, or even if they just like looking at them and they love the beauty of them, they find something from it. And then later on, 10, 15 years later, perhaps they'll think, well, this is not working for me anymore. It's often, different demands. I had a client a couple of days ago who just said to me, how do you adult? I can't do this. Don't know how you guys do it. And she was right. She couldn't. She just needed help with that. And the jumping that you're talking about put you in a state, as I would see it, because I'm also an art therapist, is there's the beauty and there's the awe of what you were doing. And you're really tapping into that sense of awe. And that awe took you away from the stuff. Sure, it was a great distraction, but it didn't just distract. Alcohol distracts, numbs, and drugs do that. But this didn't just distract you and numb. It brought in a sense of, amazement, wonder, and let's not beat about the bush, dopamine and adrenaline as well, which are very, that's what you were getting from it. And then when that tap gets turned off, what do I do? What do I do?
Yeah, and it has a very lasting effect in a way too, because it's not just that jump; it carries on throughout the day, and days even sometimes.
Imagine days,
and
so euphoric, but also just feeling good in your skin, feeling able to deal with the world, and whatever it throws at you.
Tapping into awe. And that's interesting concept. I don't think that we've talked about this in the past. Maybe would you elaborate a little bit more on how that can be therapeutic?
Yeah, absolutely. So one of the sort of tenets of art therapy, but I think it applies to what you're doing with base jumping, wingsuiting, whatever, is this sense of awe. First of all, you're in an environment that is awesome. Big scenes, cliffs, mountains, beauty. And that touches something in the human. And the same parts of our brain light up when we see things that are beautiful, or very similar parts of the brain light up to when we see things which give us awe. And the idea is that one of the reasons why art therapy in particular is interesting is it takes people to a place of beauty. And as I say, you'd be going to a mountainside and a cliff and then having those sensations as well as you jump. It basically wakes up our senses, all of our senses, and also those parts of our brain that kind of make us feel good. So you are getting the dopamine hit and the adrenaline rush. And sometimes there are certain people that need more adrenaline than others because they need it as a kind of kickstart. And then once they've got it, they're in this place of I'm functioning well. But again, it's about balance, isn't it? It's about doing it in a way that is in balance in your life and that you can do enough of it so that you get the therapy from it. If it gets taken away, that you've got something else that you can put in. If you're a new father, arguably, maybe it's not something that you can do all the time. It is the reality of the needs of the children and your wife and the people around you. So what can you do instead? What can you do instead to stimulate that same thing, that resource, and that you're not just a one-trick pony?
I don't know. Do you have any ideas?
Well, I would say, because it's my interest, I'd say that literally looking into beauty and awe as a subject about what really do I find beautiful? what do I find awesome, and how can I, for my system, make that work? It's not for someone else to almost prescribe it to you, but it's what makes you feel that same feeling, what comes close to it, even if it's not the same. I can't imagine there are many things that feel the same as jumping. As I say, it's not something I've done, but I mean, yesterday, I was talking to you about it earlier, you know, I've just been recovering from surgery, and yesterday I went for my first full day ski. And, you know, it was limited because we're getting better, I'm getting better. But I did notice in certain moments I was feeling that awe. And every time I noticed the awe that I felt, either scenery, my friends, what they were doing, my own sensations in the ski turn, the speed, I took it in.
That's interesting. And when you're telling me this story, it's like I'm almost thinking about, I'm realizing moments that I've really enjoyed jumping, and they've definitely had elements of this this awe.
Yeah.
And I think that it could be really helpful for understanding what it is that I want to get out of jumping, and having some perhaps peace with that. Because I think it's really important to understand what it is that we want out of something that is high risk.
That's key. That's absolutely it. It's and then it comes back to the self-regulation and the awareness of, why am I doing this? I'm not just doing it because someone told me to, or it felt really good last time, or people admire me for doing it. I'm doing it because there's something intrinsic that it's doing, and I'm encapsulating that, and I'm enjoying that. And the minute that stops happening, and maybe I'll stop doing it because it's no longer bringing me that thing. There's a whole sort of school of research at the moment around the science of awe, and also connected to the science of beauty, which I'm fascinated in. And I'll give you some references at the end of this, so if people are interested, they can look into it. But yes, if you can just in thinking about it, you can tap into those moments when you were doing your sport and you felt it. And that's important.
So I think it's also interesting to talk about the type of resilience that we can gain through maybe identifying or working through some of these challenges, or perhaps when our needs aren't being met, and how it can be helpful for preparing for an injury, for preparing for a loss of somebody.
Yeah.
That perhaps maybe we don't need to wait until some catastrophic moment in our lives, or we don't need to wait until that cup overflows, as I put it earlier, to start approaching our health. And one of the ways that I've talked to people, and correct me if you think this is wrong, is I had this conversation with a colleague recently who was feeling particularly bothered by some of the imagery that they were seeing in Gaza.
Yeah.
And they had a preconceived notion about therapy and what it could offer them. And the way that I told them about it is, in my perspective on it, is that it's kind of like going to the gym. Is like you're instead of just like, you know, strengthening the muscle, you're strengthening this muscle of that need structure that you're talking about.
Yeah.
Like it's checking in that all of those needs are being met, and that perhaps you're setting up a foundation to have that structure in place when things, like seeing children dying, you know, in someone's arms, or
Unbelievable to see that every day as a journalist.
It's horrible. And if that structure isn't supported accurately or appropriately, you know, the structure falls down. Yeah. And I think that may have helped them to realize that, oh, this doesn't need to be something where, oh, there's something wrong with me. It's that we all have this structure that I'm maybe putting words into this context that aren't appropriate, but I think it was helpful.
Yeah, no, I'm sure it was. And I'm sure you did an awful lot to settle them down, settle their nervous system down, which is already aggravated by the imagery they're seeing at work, that there's something wrong with them. And there really isn't. I mean, it's a completely human response. In fact, what they're doing is they're showing that they are human and that they're not shut down to be able to look at that day in, day out, and not be moved is more of the issue, isn't it? Because it means that your mechanism for dealing with it is so effective that nothing can get through, and that is perhaps having impact elsewhere. But to get in touch with your humanity, that you are moved by it, is an important piece of self-realization, and there is absolutely no shame in that. There's no shame in being upset. There's no shame in being upset at work, especially, I mean, any job, to be fair, but especially a job where you're seeing that kind of imagery day in, day out. And I know exactly what you're talking about. We used to have meeting rooms, the company I worked in, with fantastic, award-winning photography from war photography and other photography. And we would have to sit there with Excel spreadsheets looking at somebody carrying a dead baby. I mean, it's just ridiculous. It's not tenable.
I brought these things up in the context of resilience. Would you like to talk about resilience?
Yeah, I mean, resilience is it's a huge topic, a bit like awe and beauty. And there are many people on different sides of the argument that say that resilience is really important. And of course, it's really important, but resilience can sometimes come out of trauma. And resilience is definitely the factor that can get us through maybe a difficult childhood or childhood trauma or later trauma. There are lots of elements of resilience which fit into the idea of defense mechanisms which are positive, because not all defense and they're protective mechanisms, but some of them are seen as negative. They can be really positive. So humor comes into it, being able to look at something cognitively and not emotionally. Is important. So in contrast to what I've just said about somebody who's not responding, at the same time, you also need a certain amount of resilience to get through the day. We can't be tearful every single moment because something's moved us, even if it has. So, of course, again, it's about the balance. All the time, it's about the balance. The other side of resilience is sometimes it can be seen as being something that is, if it's not true resilience, if it's a created protection, it can be brittle. And at that time, it can be something that can be problematic, because if someone is deeply resilient, they will snap if it's not the sort of thing that can bend. The idea of the Japanese idea of the bamboo can bend, but it doesn't break because it's not brittle. And there's another analogy around resilience, which I really liked, was a friend of mine, comparing to thinking about the bamboo that does bend with the pressure and the strain and doesn't snap. A friend of mine who was studying to be a carpenter told me about how they used to make mills, as in like windmills, for milling grain back in the day. I mean, we're talking 200, 300, 400 years ago. I don't exactly know when it dates from. And they used to use a different wood to actually be inside the mill, and the wood that they used would be more less resilient. It was actually more crumbly, and it would actually snap under pressure, because if a storm came through and the turbines were going round, the sails were going around really, really fast, inside the mill it would become chaos, out of control, and it would kill people. So they wanted it to have a fail-safe of it actually would break. And I think that idea is also important, and that's where therapy is good. Is for when that feeling of overwhelm happens, it's not necessarily a disaster. It's actually a sign that this is a good moment for us to look at this stuff, and we can stop the turbines going round, and we can stop it and stop everything. So not resilience at all costs, but resilience as something that can be used when it's useful and appropriate, if that makes sense.
Absolutely. I think that's a great analogy. I think that there's also a couple of things that I'd like to back up and touch on as well, is this nervous system. And then also using base jumping as as a drug, so to speak.
Yeah.
There's therapeutic dosage, and then there's abusive dosages.
Nice way of putting it. Oh, that's really good.
And thank you. And then what you also said is that therapeutic dose may be ineffective at certain points. And what I experienced personally is that when I was feeling overwhelmed and I was looking for base jumping, even though I wasn't able to do it as much, it didn't have that therapeutic effect.
Yeah.
And I think it had something to do with my nervous system,
Yeah.
because as my cup was overflowing, I'll
Exactly.
continue to use that analogy,
Yeah.
is that my nervous system was just zapped. And
Exactly.
when I wasn't able to experience this sense of awe that you brought up, I wasn't feeling this, gratitude and appreciation for what I was doing. I was sort of looking to not feel a certain way anymore. Yeah. And it wasn't till I worked on my needs, like you said, that came back.
Interesting. Yeah, that's very interesting to hear you put it that way. And I'm glad you bring it up as well, because I think we went right back to basics around self-regulation. So we were, you're a person that comes from a sport that has taught you a lot about self-regulation, and you didn't need to come to someone like me to learn about it. But what we went right back to the beginning of that and beforehand and just looked at our breathing. We just looked at learning how to literally relax our nervous system by doing something called 7-11 breathing, which is simple. All we do is we breathe in for a shorter count than we breathe out. And in doing so, we allow our breath to go right down to our belly, so it kind of really expands as we breathe in and contracts as we breathe out. And this is how newborn babies breathe. It's a natural thing for humans to do. And we kind of forget how to do it, either through sitting in a certain way or stress or just not feeling right about our lives or panic. And actually, if you think about a panic attack, which is the opposite, it's very high breath that occurs at the top of the chest, and it's very fast breathing. So although the sport had enabled you to develop this whole thing around self-regulation, when the sport wasn't there for you anymore, we looked at it from really went back to basics. And by allowing, the reason why this breathing works, and we're talking about a nervous system, is that when we breathe in, we activate our sympathetic nervous system. So that's the excitement, the getting ready to go. And when we breathe out, we activate our parasympathetic nervous system, which relaxes us. And the simple idea is, if you're breathing out for longer than you breathe in, your parasympathetic nervous system is active for longer. And we can't be stressed and relaxed at the same time. So effectively, the numbers mean that we win out and we end up relaxing. Once we're relaxed, we can then, literally relax in a nervous system way. And we're not talking about meditation here. We're talking about literally just relaxing our nervous system. We can begin to look at our needs and see things in a different way. And it's not a fight and flight response. It's a relaxed response about what do I need to do here. And we get our cognitive side online, and it's not just an emotional response.
I think that this is a good place to transition towards the grieving process. Yeah. Obviously, if someone is involved in base jumping for an extended period of time, they're going to lose a friend and or witness a fatality accident. It's just part of the game.
Yeah. I think it's really important to name, I suppose, that we kind of live in a grief avoidant society. You've already touched on that when you talk about the pain of certain jobs and the visual images in the newsroom. The fact that was even an issue kind of shows that we're avoiding this altogether. And there's a lot written about grief and how long it should take. The DSM, which is the American manual, which is a sort of go-to for all pathological problems that someone might have, says that someone should be over grief in a year. And if it's not fixed in a year, it's pathological and they need help. This is just so against the truth of what grief actually is. It can take a long time. But it can also take a short time. It's very much dependent on the person and their own experiences to date. And you can divide grief into two parts, really. One is it's universal grief. So we've talked already about, actually, in a way, what you were talking about at a very minor level, it wasn't minor for you, but when you lost the ability to go jumping as regularly as you wanted to, that was a loss. And that is grief. The grief comes into that. It's a universal experience that all humans have. Losing something, losing a season, losing an ability. We will have grief over that. And then there's traumatic grief, which is more where we're moving this conversation into now. And traumatic grief is more about losing a dearest person or a beloved person. And it is sudden, unexpected, and it's a death that is sort of out of order, meaning, it's before their time. And that's really what we're talking about here. And so what we get with that kind of grief is we have the generic universal experience that humans have of grieving, interwoven with perhaps the trauma of how it occurred. And how can we live with that? How can we prepare ourselves for that? It's a really, really good question. I was talking before, and I don't know whether it was, it came across as so much jargon or whether it's clear, but we've got this idea of sort of a young consciousness, which is this part of us that is trying to deal with difficulties in our life when we were younger, and these became our conditions, our conditioning. And then there's adult consciousness, which really gives us agency, as in control, back to that need of control, and the permission to feel. And given that we live in this grief avoidance society, I'd say that would be the first thing that I would say to anybody who was contemplating, concerned, or really sadly at this very moment experiencing it, is that permission to feel is from this place of control where you can allow it. And grief is something that happens to all humans, as we've said, and all humans will do it, and all humans will go through it, and all humans need to do it, but it will be different for everybody, dependent on their circumstances and the context, as we said already. There are sort of like ideas around stages of grief, or there are ideas around how we can deal with it therapeutically. What in particular would you like me to focus on?
Well, I think it's particularly powerful to understand or normalize, like what we were talking about before, that this is something that everyone should and can feel.
Yeah.
And so perhaps if you talk about the stages, maybe I can relate to a particular stage, or someone listening to this may be able to relate to that, which will then help them to feel normal.
Yeah. Yeah, so it's interesting though that there is this idea that there are stages of grief and you have to go through all the stages to grieve, so-called, properly. That's been debunked. In fact, that idea came from a researcher who was researching into how people dealt with a difficult diagnosis. So there were people perhaps at end of life, or they had a degenerative disease that they were being informed about. And the doctors at the time were noticing that they did go through these various stages of grief, which we've heard about before: denial, anger, acceptance, bargaining, and these terms. So it does, that, in a sense, that model didn't even apply to someone who'd been bereft. It applied to someone who was dealing with the first form of grief, which is our universal experience when we lose something. So it's relevant, but we don't have to go through them in any order. They can take as long or as little as they need for us to process it. And what I tend to observe more is that people kind of spiral in and out, and it can be a spiral that's going up to a place where they finally feel they can accept this really sad event in their life, and they can then build their life back around it. But it never actually leaves them. It's always something, it's part of their life, it's part of who they are, because they've experienced it. It's not something that we put into a box and say, that's it, it's over, necessarily. And the spiraling means that actually we can go in and out of denial and acceptance and anger and bargaining, for example. And they can happen in moments, they can happen in weeks, they can happen over years. But people will suddenly find themselves, people who have suffered grief will suddenly find themselves back in a stage, and there's nothing wrong with that. It is a heart-opening thing. It's something that again, it makes us human. It's what makes us human. From a therapeutic point of view, I think there's a lot about, attuning with the person who's experiencing this. And this doesn't mean that the person has to be in therapy to do this. And people in the community can just attune and say, yeah, we get it, that this is how you're feeling. And that's it. There's no right or wrong way to feel. There's a sort of surrendering time where we kind of just feel engulfed by the intense emotions. And we'd need that to really get to the point of understanding that this has happened. But we can do an awful lot of things with, so we can have rituals. People like to do that. That's why we have such a ritual of funerals around death. But we can make our own. It don't have to be other people's.
Now, I'm glad you say that, because, man, funerals never made me feel good.
No. But it's just what our society does to mark that moment, a transition from that, and to get together. And there's a lot in the planning as well that gets people's minds organised and keeps them busy. But yeah, you can do other things, rituals, creativity. It could even just be acts of kindness that you yourself could then could do things for other people. It doesn't have to be that you go to and visit the grave every day and weep. Whatever you do, if you're supporting somebody in that situation, it goes back to getting into their model of reality, walking in their shoes, no agenda. If they're still feeling bad after 3 years, they're still feeling bad over 3 years. There's no shoulds around it. They just need the time that they need. And that allows them to have, going back to this idea of agency, allows the person who's grieving not to feel criticised or wrong. They can do it in their way. And it gives them back that sense of agency and control, if that makes sense.
Yeah, that makes sense. I'm wondering if I could ask a question, and forgive me if I get it wrong, because I think this is a little bit of a delicate topic in terms of people's thoughts and approach to therapy. Is there a particular moment when someone should consider that they actually do need help with getting over their grief or moving through their grief?
That goes back to the question of how long should it last for, doesn't it, really? Yeah, it's a live relationship, really. Losing somebody is something that we have to make sense of in our life. And if there's something that is not happening, that is meaning that we can't do our day-to-day things, then it would be good to talk to somebody who understood and didn't judge, had no agenda, and could listen to it. And sometimes that's what someone needs, is just to be told you're okay, to be feeling what you're feeling this week. And there's nothing wrong with also keeping that person's perhaps never go away. They always are part of you. You've experienced life with them. They've influenced you. They've impacted you. They're always part of you and they live on with you. But it's how you reconstruct a life around that perhaps therapy could be helpful with, and doing that in a constructive way. But no, I think I've known people who've grieved for many years, and it changes, but they're still in that state of needing to find a way to build a life around that person, and that's what's important to them. If you try and take that away, they will become potentially resentful of that or defensive, because it's almost like a disloyalty to the person that they're grieving. So there's this idea of it.
Sorry, if I could clarify, if you're saying then that if someone feels like they're not feeling grief anymore, that they might feel guilty about it?
Yeah, that can happen. People can grieve in days. Some people can grieve in days, and then maybe 10 years later, they'll grieve again. There's no right or wrong. The sort of stages of grief idea has made people feel that they do it wrong sometimes, and they're not. It just seems to be a human thing that all humans do. But because we're human, we all do it a little bit differently.
So you touched on briefly about how when someone in the community is dealing with grief, how we can help them just by listening. Do you have any more suggestions about how we as friends or family members help people who are having a sense of grief or dealing with grief?
this goes back to that understanding that it is their individual experience. And if there's something that's coming up that maybe, there's a sense of this is going on for a long time, I'm giving that as an example, or this seems out of proportion, to really examine that in yourself, in that what is coming up for you around grief, given that we've all grown up in a grief avoidant society. So it could sometimes be that it's something that the wider community is feeling, that this person, I'm picking on this idea, I don't know whether it's relevant, but this person maybe ought to be moving on. It's not that. It really going right back to this point that it's something all humans do, and this particular human being is doing it in this way. And if we find it frustrating or long, or we're concerned for them, maybe we don't need to be. Maybe we can examine ourselves. How have we been allowed to grieve? What were we told about grief? And the should and the shouldn't. And are we pressurizing ourselves or made to feel uncomfortable by their grief? That's a very long way of saying the best way to help somebody in grief is to go in with no agenda and not tell them how to feel, because actually what you're doing is if you're saying that, it means that it implies anyway, it may not mean, but it implies that maybe there's something going on for you that is uncomfortable with how this person is. They just need to be validated that their loss was big. Sometimes they just need to be heard.
You said that there's no right or wrong way. And I think that there may be a caveat here, because something that I've seen often is a reduced sense of self-preservation.
Wow. Okay.
Meaning that people who are grieving the loss of somebody within the base jumping community may be more inclined, rather than, being analytical and careful with their decision making, a lot more of, hey, fuck it, kind of sneaks in.
Yeah. Okay. That's important. That's important to name. So we're getting now away from the sense of, the way that I admire the community is this sense of we only do it when we are in the right place. That person is not in the right place, clearly. And I think you're right. There is that caveat is a big one, because that person is now, given the constraints of your sport, I use the word constraints, but the safety issues around sport, that person is putting themselves, is self-harming, is crossing the line over that. And I think that an intervention then is, of course, important, because that will have an impact on them and other people. But how you deal with that is much more, I would say, is much more along the lines of how you would deal with someone who's having suicidal ideation, suicidal thoughts, which are concerning them. I mean, we have, I don't know how many thoughts we have in a day, thousands, tens of thousands of thoughts, and it's quite possible in any day, anybody can have the odd thought of, I don't want this anymore. That's possible, and that's not what we're talking about here. We're talking about something that would actually take someone to take a risk, and I think stepping in is legitimate. The agenda is, so I said you deal with this with no agenda, but in this case the agenda is that you are you're noticing something and you're concerned for their overall safety. And that's the same with anybody who's also got suicidal thoughts happening as well. We have to, again, we're a grief avoidant society, but we're also really scared of this stuff. We're really scared of suicide. And it's a very difficult topic. It's a topic much, much bigger than what we have time to talk about today. But at the same time, it comes from a place of fear sometimes that we will avoid going there.
Yeah, I think it comes from a lot of what we've already discussed, is like this sense of, the therapeutic dose of jumping starts to become, instead of taking a single pill, we're taking 2 pills. The intensity of your jumping can give you a different result. And oftentimes that means taking more risk, flying closer to the ground, doing more technical exit points. The list kind of goes on, but increasing the intensity of your jump can give you perhaps more of that therapeutic dose that you're looking for.
In my mind, what I'm hearing you say is you're tapping into this idea of intensity and feeling numb, and numbness is a grief response, but also that there is a trance state. I'm sure that there must be times when jumping creates a trance state as well, where we are in an altered state, but very focused. And, not if someone taps you on the shoulder, you're not going to hear them. Sometimes when people sadly end their life, we can find out afterwards when they took action, they were in a trance state. And if someone could have it's easy to say, but sometimes we can snap people out of that state. State can last for seconds, it can last for weeks. And grief in itself kind of creates one of these states as well. We all use trance, actually. We go in and out of trance all the time. Just as we're talking, occasionally I'll put my eyes up to the roof, or you look outside at the beautiful day it is out there. Just it's a way of us collecting our thoughts and coming back to what we do. And trances can be second long. But that second could be what it takes. And which comes back to my interest right from the beginning. It's around the self-regulation. The self-regulation is definitely not in trance. I know where I am. My feet are on the ground. I know who I am. I may be feeling really bad because I've lost somebody, but I know who I am and what's happening.
I wonder if we could talk about how to approach people who are maybe in this place of taking excess risk, because this is an extremely challenging topic and subject is, and what we see often is, I can say from personal experience that it's very difficult to have an accurate perception of your own abilities, meaning my own abilities.
Yeah, but anyone, you're right. Absolutely.
And that oftentimes as friends and jumping partners, we'll see somebody engaging in a way of flying or way of jumping that we go, whoa, wait a second.
You've changed.
You're doing things a little bit different. I don't recognize this. I'm nervous for what you're doing here. I've seen this before, and it usually doesn't end up well. We could go on and on about this, but is there, from your experience and your expertise, a way that we can perhaps learn more about this or be more effective in reaching people that are in that position?
Absolutely. You are talking about a situation where effectively the community, and I'm going back to those needs again, the community is there and recognizes that this person is just not quite themselves. There has to be recognition of that, and presumably, and now again, maybe I have rose-colored glasses on, but presumably the self-regulation that we've been talking about all the way through this is something that person, even in their altered state of grief, their depression that's come from it, their sense of loss, or whatever it is, their lack of meaning and purpose, whatever's been triggered for them, lack of meaning and purpose, for example, that self-regulation is something that you can actually bring in to talk about and to actually name it as a thing. That this is not a reflection of you and your capabilities, to go back to that idea, your abilities, your achievement, what you're able to do, your status even. This is about you in this moment. And there is a feeling that some of us in the group are picking up that you are behaving differently. How do you feel about that? And I think to definitely give them ownership of it. And it could go either way from there, couldn't it? The person could deny it completely and say, that's just crazy, or you're right. And then you've got a chance to attune to be with that person in a non-judgmental way for as long as it takes to talk about it openly. If you get the denial, I think it's more difficult because you're kind of beating on a closed door, and you have to get to the bottom of why the door is closed, why there is the denial. And it probably, my first hunch would be if this person came in to see me because people were saying this to them and they were getting annoyed about it or something, but they had this terrible loss and would be to go into what's going on with the peer pressure and what's going on with the self-pressure, because that's what we've discovered, isn't it? That it's not just peer pressure, it's also self-pressuring. What the meaning of the loss was, and to actually hear them. But I think that they're two different cases. It's starting off from an open discussion of let's not be scared of this. Let's not be scared. We are seeing it. It is something that we need to hold, to see. And then if we get a good reaction, then just be here, listen, no judgment, attune. If we get a defensive reaction, I think it's what is behind the defense. Why has a defense come up and what they're afraid of that you're seeing in them? And it's probably self-pressure, peer pressure, or feelings of failure, or the grief itself has put them in a trance state. Now, it's interesting. There's some good. I'm linking this a little bit with sort of research into suicide, because I think there's a Venn diagram, and we're crossing over, and there's a bit of an intersection here. I'm not saying that anybody who's been behaving dangerously is suicidal, but there's a point about opening up the question. There's a good public speaker in the States called Kevin Liles who does a lot of work on the trance state of this and what can be done, how people can actually reach out when they're worried. Because it is a difficult thing for bystanders to do. But his point is it's the bystanders that can actually make the difference. They're the ones that can step in and stop it. He jumped off the Golden Gate Bridge himself. It was a suicide. And he says that he literally lists the people that he met that morning who could have made a difference and stopped him. He was ready to be stopped, actually. But no one did, because they didn't know him, or they were strangers. He got some guys to take a photograph of. They asked him to take a photograph of them, and he was clearly in a distressed state, but they didn't step in. And this is just in civilian life. So I think in your community where you're closer and you know each other better, it might be good to have some way of naming this and having it as a thing that is okay to talk about.
Yeah, I think this applies for people who maybe are grieving and saying, like I said, sorry to be crass, but fuck it a little bit more than normal.
Yeah.
But also I think that this is a general approach to things as well. And this often is a huge source of frustration to people who've been in the sport for a while, is new guys or girls coming in and acting like they're invincible. And it's, real easy for us to step in and be all cranky and go like, what the fuck are you doing? And we do the exact opposite of what you just said. And let me see if I got it right, is basically like shortening the time frame of their actions and saying, what's happening right now may not be a reflection of you as a whole. And then, not owning it or blaming them, so that there's a position of being open to discussing this as like, hey, this is actually something that we can all chat about.
Yeah. If you could get to that place, it would be fantastic, wouldn't it?
Mm-hmm. And then if you're met with denial, then that can be a little bit more challenging.
Yeah. But the denial is there for a reason, and you just go in again with the same approach of why is this person not admitting to themselves. And if you do that, it's an overused word, but if you do that with compassion for them, not judgment, but compassion, they're denying it for a reason. In other words, they're probably not even getting it themselves. I mean, that's basically what therapy is that you're holding somebody's, either you're holding them when they're opening up, or you're holding them when they can't, but you're still not judging them, and you're waiting for them to feel safe enough to say, yeah, actually it's because I think everyone will think I'm just useless because I can't do it, or something like that. So I'm trying to show them, or I'm angry, I'm angry at what happened. I'm angry at the loss. And say, well, take out your anger, not on the side of a cliff.
Somebody that we had on the podcast recently actually shared one of those experiences where he was on the receiving end of this, and it was his knee-jerk response was to deny it. And it wasn't until later where he was like, wait a second, wow, this is, he was able to see
Exactly.
that he was doing the same thing that he's, fought so hard against before.
Exactly. And that's exactly that's part of the human response. But in the second example of the denial, and like this person you describe, I mean, if you can just buy time, I think, again, to use an analogy from somebody who's actively threatening to end their life, sometimes it is about buying time. And without sounding dismissive of how they're actually feeling in the moment, which is the worst you could ever feel, that feeling passes and they don't feel it next week and they went, oh yeah, I get it. I'm so glad I didn't take action, but I could have done. So buying time and intervening and stopping. But I would have thought in a community like yours, it would be something that it would be really possible to start to, as you've begun to notice it. I mean, it's a new community, isn't it? It's a new sport. And you're just learning as you go. And the people who are now experienced weren't experienced back in the day, but they are now. And so if you'd had people come to you like that when you were out there younger, you would also maybe have gone, I don't want to listen to you. You've been cranky and boring, and I've got this thing I want to do. But it's now you've got this knowledge. It's maybe about saying that we've built this knowledge and we want to share it to make it a better sport for you as well.
Yeah, I mean, in short, that's basically my motivations behind this podcast is to make it, to leave it better than I found it, but then also to equip ourselves, me in particular, with tools to be more successful.
Yeah, indeed, and share them and have a repository of knowledge. But at the same time, also, it's like an ethos, isn't it, within the community that we can talk about this stuff because it is close. It is close to you in the nature of the sport. So it shouldn't be a taboo. It shouldn't be something that you avoid. It should be something that we can talk about. And like we said, as a society, we don't really like to go there anyway.
I agree. We talked about base jumping as a therapeutic drug a couple of times, and I think it's important to talk about drugs and alcohol.
Yeah.
Because maybe we can go back to the DSM here, but we're often labeled as sensation seekers.
Yeah.
And with that sensation-seeking sort of persona or quality, we often like to dabble in drugs and alcohol. Mm-hmm. And oftentimes when we're dealing with grief or any of these feelings that can be overwhelming, that is a source of relief.
Yeah.
I think that drugs and alcohol can get in the way of actually, from my own personal experience, of actually dealing with the situation. And to use an American term, it can turn into a game of whack-a-mole in a way. It's like something bad happens, you take the joint or the alcohol and bang that mole until it goes back, and then another one pops up somewhere else. And rather than dealing with the therapy or dealing with the issue, it sort of just sinks down and pops up in some other avenue of your life. I don't want to put words in your mouth here. What are some of the issues of drugs and alcohol that you see within similar personality types of, adventure sports athletes?
Yeah. I mean, I don't know whether it is a personality type or I don't know whether it's a combination of personality types and experiences. One area that I'm absolutely fascinated by, and I don't know if you've looked into them, is adverse childhood experiences. The ACEs study back in the early 90s discovered that only 10 different experiences we need to have had can actually make us more susceptible to enjoying alcohol and drugs later on in life, for example, and a host of other things. So it's not just about alcohol, it's also about other health issues. Now, as I say, I don't know whether it's personality type or a similarity or coincidence of where so many people who live in this environment have come from, and I would include myself in that. I'm not putting myself above. I think we all have come from a certain aspect of childhood experiences which are similar, I notice. And if you look into, for example, there's an addiction unit down in Salanches, and I worked there for a bit. We did a study. Every single person there we were talking to had at least 4 adverse childhood experiences. And this fits the bill across the board, that people who have a problem, now we're talking about addiction, not just using to numb out, which is prior to actually feeling addicted. But it's most likely that if someone actually gets to the point of being addicted, that there is some history that we can help them with, again, therapeutically. So what do I think of it? I think absolutely right. It is exactly that. It is that game where you're just hammering something down and then something else is coming up elsewhere. You're not dealing with the source issue, which is often shame or self-pressuring or something like that around something that happened to you when you were little, or maybe something that happened to you in your 20s or 30s or something. And alcohol is the best anesthetic. I come back to awe and beauty, and the word anesthetic is actually, if you think about it, it's about not feeling, but it's got the word aesthetic in there. And one way of looking at alcohol is, or other drugs, is why am I taking this and what am I trying not to feel? And whatever it is I'm trying not to feel, I'm not feeling it, and that's fantastic. But it doesn't mean to say it's gone away. There's a lot of drugs and alcohol, and we could say a lot of drug and alcohol abuse, but that's a bit judgmental. However, you put it absolutely right in what you said, that we take alcohol and drugs, other drugs, to stop feeling. Full stop. If we see it as an anesthetic, and it functions as such, it also functions as that, but it also, it helps us socially and be more relaxed and all those things. But for underlying it, we're trying not to feel something. And like you say, jumping allows us also to, you had those moments of not feeling that you described about, but you were feeling something else, you were adding something else into it. So it was a positive feeling, a sensation. Your senses were engaged and you were feeling things and you got to that state of awe. And I liken it to the state of seeing something that's very beautiful. So it's almost spiritual. And when you're actually adding that in to it, you're feeling these amazing feelings. Alcohol does something similar, but it doesn't take you to the spiritual, the awe and the beauty place. I think that's the deficit, and that's where it doesn't work. And then it is also addictive and causes great harm, as we know, but we all do it, and we all live in a society where it's acceptable. So
I can't help but notice that you're focusing on the alcohol part. Now, do you have some apprehension about talking about drugs?
No, I don't. I can talk about the drugs. I see a lot of people, and we're talking here about the overwhelm on cocaine, and trust comes into that as well. Certainly in the people I see, it seems to take away their ability to trust, with the paranoia the well-known paranoia of cocaine coming in. I mean, drugs and alcohol, we could use them, we could say it interchangeably, that what's happening is somebody is using a substance in a similar way that we might use a sport to feel a sense of exaltation or to feel a sense of something very great. And it does up to a point, but then it also is anaesthetizing us against what we're actually feeling. And I'd like to also add that in all of this, it's about not being judgmental about it, because we're humans and we have an addictive process. The reward circuit means that we will slowly become addicted to these substances, especially if they work really well to stop us feeling. That makes sense.
Yeah. I also appreciate the fact that I'm asking you very broad questions about massively dense topics.
Yeah.
And it's difficult to get to the root of all of these.
I think the reason I went to alcohol most is the anesthetizing side of it. The other drugs do different things, and they also work on our reward circuit slightly differently. But what I see most of in this community is cocaine and alcohol, I'd say.
Okay. Another very broad topic that I'd like to address somewhat briefly is psychedelics. And I know that this is something that the base jumping community it's very prevalent, and not necessarily just as an escape, but also because of the rise of the popularity and its therapeutic properties.
Yes. And
I'll be the first to say that I've had some huge growth experiences through psychedelics, and under the right setting, psychedelics can be absolutely helpful and have helped me tremendously. However, that set and setting isn't always respected, perhaps.
Yeah.
And could you talk about, from your experience, about maybe some of the dangers, and then, or anything else that you'd like to discuss on that topic, in terms of, when someone is looking for a therapeutic result from psychedelics and it may give them the opposite?
Yeah. I think like all things, there is no magic bullet, is there? And I really like the way that you explained that you've had some fantastic experiences because the setting was right, and it's been growth. And it's deeply frustrating with psychedelics that, in a sense, they were, since the 20s and 30s, that they were sort of outlawed, and all this sort of research into them was stopped. And now you're getting pockets of really interesting, good research that is coming out. I'd say it's really early days, and I'd say that I have seen, so I have clients who've said that they use psychedelics. I don't work with them myself, but they've talked to me about the effect, and they've talked about the growth that you're talking about. But I have also spoken to people who have had experiences that weren't so good. I haven't had enough to be able to build up a picture to say it is, this is right or this is wrong. But I have seen that it hasn't always gone okay for them. But they have been able to come back from that through therapy and just a bit of holding and making it okay. It's been okay in the cases that I've seen. So I'm very excited about it. It's not my area. I'm very curious. And I see that people are beginning to self-administer. And it's a new thing. And there will be problems from that. But there will also be some good things, I guess. It's my view.
From my experience in observing and talking to people that, doing this like self-administering like you're talking about, excuse me, is if we can describe trauma as a box, or we put the trauma inside of a box. With my experience with therapy is you sort of ease the lid off a little bit and kind of titrate that exposure to what's inside of that box in a controlled fashion.
And titration is it's a really good word for it. Yeah, just how far can we go? How is it? Just
and
add
then
a bit more.
Using psychedelics is kind of like either just destroys the box or rips the lid off the top of it.
Yeah.
And
that's why you get good results and not so good results. And I think it is very much that. And I mean, you have good trips and bad trips. Certainly, as a teenager, I can remember both. Like you say, there's the boom that goes on, and if that boom is good and it can be handled well, I would definitely, for that reason, and if there's any hint of trauma or anything there, I would say it's better to go with someone who can hold it and has experience of doing this and has a methodology that you trust. That would be my recommendation, definitely.
Do you have any ideas on how we can wrap this up?
Yeah,
we've covered some very broad ground.
We have. Well, this is it. I mean, because we're talking about humans, aren't we? And we're talking about humans in sport and lots of variables. The keys for me are the self-regulation, and I keep saying that word, but what I'm really talking about is the fact that when you know that you're in the right place, when you're about to perform in your sport, and you know it at every single cell in your body, is what I find so fascinating about people like you who do this. And that is something that is really useful for the world at large, the general population. And I think a lot of it is around these ideas of beauty and awe and really feeling into those. And I think the more difficult, dark areas of what we talked about, where humans butt up against tragedy and grief and traumatic grief, is not to be afraid of it, because you're not afraid of the other stuff. It is in fact the same thing. And there's enormous capacity for growth there when people are self-aware of that and not afraid to go there.
Well, Sarah, I found this conversation extremely interesting and very helpful. And if anybody is listening to this and something you've said has resonated with them and they'd like to work with you, are you able to work with clients, patients in the United States or in other countries?
Yes, I do. I do already.
Okay.
I work online. Welcome anybody. I mean, if you just want to touch base and just to find out about a bit more about the issues we've talked about, more than welcome.
And how can they get in touch with you?
I have a website. It's not the most up to date, but it's chamonixtherapy.com. And I will. What I'll do, if it's okay, is I'll send you some of the resources about some of the things we've talked about. People can make their own research as well, and I'll put my contact details on there.
Perfect, and I'll include those in the show notes.
Thank you very much. It's been really interesting to reconnect and to see, to hear all about it.
Thank you so much for your time and sharing all of this.
Okay.
We hope you enjoyed this episode. If you have any thoughts about what you've just heard, please don't hesitate to hit us up. A big shout out to Mark Stockwell, our sound mixer and co-producer. We love you, man. If you'd like to learn more about the podcast, please visit exitpointpodcast.com. See you on the next one.